Assalamu alaikum everyone. Welcome back to my channel. I'm Dr. Nusaiba Jannat. In today's video, we'll talk about Prazosin Hydrochloride, its uses, how it works, dosage, and side effects. So stay tuned till the end. Prazosin Hydrochloride is a medicine that belongs to a group called alpha-1 adrenergic blockers. It helps to lower blood pressure by relaxing blood vessels, making it easier for the heart to pump blood. Although it was first used for high blood pressure, it is now used for other conditions too. How does Prazosin work? It blocks alpha-1 receptors on the smooth muscles of blood vessels. This causes the vessels to relax and widen, which lowers blood pressure. Unlike some other drugs, it does not usually change your heart rate much. Now let's see the main uses of Prazosin. Number 1. To treat high blood pressure or hypertension. Number 2. To help men with enlarged prostate or benign prostatic hyperplasia by relaxing the muscles in the bladder neck and prostate. Number 3. To reduce nightmares and improve sleep in patients with post-traumatic stress disorder or PTSD. And number 4. Sometimes it is used along with other medicines in heart failure. Next, the dosage and how to take it. Usually, the starting dose is 1 milligram taken at bedtime. This helps to prevent dizziness or fainting that can happen with the first dose. This effect is called the first dose phenomenon. Later, the dose can be slowly increased as advised by your doctor. For high blood pressure, the usual range is 2 to 20 milligrams per day, divided into 2 or 3 doses. Now let's talk about side effects and precautions. Common side effects include dizziness, lightheadedness, headache, drowsiness, weakness, and nausea. Serious side effects are rare, but if you feel faint, have chest pain or swelling of your feet, contact your doctor immediately. A few precautions to remember. Always take the first dose at night. Stand up slowly from sitting or lying down to avoid dizziness. Avoid driving or operating machines until you know how the medicine affects you. Prazosin is generally safe when used correctly, but always tell your doctor about other medicines you are taking, especially those for blood pressure, depression, or erectile dysfunction, because drug interactions can occur. That's all for today's video on Prazosin Hydrochloride. I hope you found this explanation helpful. If you learned something new, please like, share, and subscribe to my channel, Dr. Nusaiba Jannat, for more medical and pharmacology videos. Thank you for watching, and stay healthy.